Welcome to the Well Workplaces podcast, where we chat with health and wellbeing leaders who create ripples of change in workplace health. I'm your host, Tom Bosna, and today I'm very pleased to welcome Dr Natalie Flatt, who's a passionate clinical psychologist and co-founder of Connect Psych Services and Connect My Mind. Welcome, Natalie.
Thanks for having me, Tom.
How are you going?
I'm not too bad today. How are you?
That's good. I'm well. In Melbourne today, and obviously things are looking good in relation to the COVID cases and stuff. We're seeing some progress, which is good.
Fabulous. Yep. We need to get out. I need to get out of here.
That's it. It's been a crazy year so far. The last 6 months have been crazy in the whole world, and especially, I suppose, a lot of us in Melbourne have been experiencing restricted lockdowns. And so today, I'm really interested in, I suppose, talking mental health with you. But before we get into that and talking about mental health and how that's impacting the workplace and the employees, of course, I'd love to hear from you, and if you could just share with you your background and your experience at Connect Psych Services.
Yeah, sure. So essentially we were pre-COVID and we wanted to be able to create, I suppose, a more digitised and evolved version of employee assistance programs and really bringing that support back to the employees. And we were working with a number of industries, I was in a number of industries previously, just really wanting to work and find some more flexibility and convenience around being able to access EAP. So essentially what myself and my other founder, Sasha Milinkovic, did is that we came together and said, well, what were the disadvantages or the constraints of current EAP and why their usage was so low, and what we could then do about it. So we went on to build a platform that has really basically been, I suppose, has a bit of a medical grade about it and a clinical aspect where we could provide convenience and flexibility along with autonomy to the employee, meaning that they could actually access services between for a longer period of time, so really between 6 a.m. to 11 p.m. So they've got that flexibility where they don't feel like they need to access that in the work time. But also being able to be what we call their own virtual assistant. So they can come onto our platform 24/7 at any stage they wanted to and go through a list of, I suppose, pre-screening questions. And when they click connect, that sends through an algorithmic calculation to match the best suited therapist to suit their needs. So what we're trying to do is just get a more time-effective platform coming up that is going to allow the employees to feel really comfortable because they're choosing then their time and their place that they can connect. A lot of the time that is in their own living room, with their cup of tea or with their cup of coffee at the time that's outside of work, where they've really got a better headspace to be able to deal with what's going on within their lives. So COVID in that sense was a bit of a silver lining for us because digital health and telehealth came to the forefront. But we were really lucky that we already had that build that could provide employees with that, I suppose, level of tech intelligence to be able to have a great match, but also to organisations where we are quite data heavy, so we can actually find some of the trends and the weak spots and some of the issues that they are facing or they have faced even within the COVID time, and then provide recommendations as what to do.
Fantastic. And your timing with this platform is quite good, actually, really, when you think of it. I mean, there's a lot of personalised wellbeing platforms coming out at the moment, and your timing prior to COVID and now your interest, I suppose, clearly in data is really emphasised in what you've created there. It's quite amazing. Now, with your own background in psychology, can you tell us a little bit about your clinical experience as well, if you don't mind?
Absolutely. So I actually started off as a child psych of all things, and worked a lot within education, and also then worked with a school-based service that would work with children under healthcare plans as a bulk bill service. So that went Australia wide, and what I'd see over the years is as I was starting to diversify the role within what I was as a general manager to support the teachers, and then that support to the teachers and starting to see their cracks within their system and the education system, and then moving up to the principal network and their cracks there. I started to go from an organisational perspective and from an industry that is actually quite rigid, meaning that they can't go and access support within school time. What offerings do they have there? And as I started to investigate more and more and more, I realised that the employee assistance needed to be a little bit more flexible for that industry. And then if you start looking into other industries, such as construction and mining, hospitality, nursing, they all have different times that they can access. But if you only really had that more so, pre-COVID there, with that more set time of when you can really go and see a psychologist under employee assistance, that wasn't working for a lot of industries. So that's where the idea started coming from. And I started getting really interested in more that, multimodal psychotherapy and where that was coming from, and investigating some concepts from America. And that was where I presented it, and Sasha and I came together, and we said, well, how about we bring this to Australia, and we bring it to Australia a little bit earlier than probably what it was intended to come to, and see if we can give that a crack. And we wanted to work on what's called the online disinhibition effect. Our main goal at the start was to really focus on those male dominated industries, and how we could provide that support, because unfortunately that's where we see a lot of more of the suicide rates are a lot higher within those industries. And we just said, well, what can we do to provide the more proactive support, so we're not getting to that end scale of mental ill health? We want to provide proactive mental health strategies so we can start to decrease that reactionary response. And the online disinhibition effect is just that. It's just like how you and I are talking right now, but you're in your environment and I'm in my environment, and nothing against, as I'm speaking to a different gender right now, it allows you in your own environment to open up a lot more, and you've also got a distance between us. So even though it's face to face, it's the environment that really makes it count. So we thought, well, that's where we want to get to, and that's where video came in. But we just didn't want to really use any video. So when we created our practice management build, we integrated it with an enterprise telecommunications platform that allows us that connectivity and that reliability to go to all points of Australia, especially if we wanted to work in the mining and construction, where we needed that bandwidth and that reliability and that really that good, I suppose, good tech and comms. Yeah. So that was really important for us as that. And I think over this time, it's really important to have, when you're moving into the digital health area, to really have that humanistic aspect. And so that's probably where both Sasha and I's skill set have come in, because we've always got our clinical psych hat on, and making sure that experience, or that user experience, is still as humanistic as if they were to walk into an office and get that same level of care.
Yeah. No, that sounds really great. And we've experienced that in our practices as well, in that the first 3 months of COVID, telehealth was not really something people wanted to try. And then at about the 3-month mark, we saw a rapid uptake. And now it's quite common in our clinics that, even physiotherapists are doing half of their day via telehealth, and people are just getting used to it. So I think being an early entry into this space for you guys is obviously amazing. And there's there's a bit more of a push from the government as well to enable more telehealth going forward. I'm really interested as well. I suppose the last 6 months has been crazy. The data that I've been reading around mental health issues in the workplace, and obviously the workplace now means in your house. You have a clear interest in data. Can you share with me what's the data showing now in relation to mental health in the workplace? What are the trends? Have you read anything, or do you know any of the latest that's come out?
Yeah, well, based on our data, we work with around 30 to 40 companies, and as obviously just the data capturing, we're just seeing, which it wouldn't come to any surprise, like the level of anxiety and stress has really created that uptick there. But also, the level of burnout is really real. and having, I suppose, the concern of moving into the new way of working, whichever way that is looking like, is that you don't want an individual who's got a flat battery, should we say, going back into a workplace that is going to be probably bring within its own stresses, from a physical component as well. So we're seeing a lot of that trend, and working with a lot of individuals on creating that level of self-care, and that has come with its own challenges, because, when we do go to work, we're, if it's an office, and it's even how you get to work, is whether or not you drive the car to the train station, you get on the train, you then get off, you go to your hole in the wall for a coffee. If you're Melbourneites, you'll understand that. And and then you walk to your office, and you're seeing your colleagues, and you're able just to even go up to their desks, and having all that creates that level of thought processes all the time, which is then starting to bring in problem solving strategies and collaboration and communication. And we've had that stripped off us, and we're also then staying within our own four walls, and we're not meant to be like this. So what we're seeing in that sense is that the level of burnout has occurred because we're not getting that, where we've got our work hat on, and then we may come home and catch the train, but we might be at that time listening to a podcast, reading a newspaper, reading a book, catching up on social media, whatever you choose to do. You've got that separation between work and home life. And so really, I know it's a little bit textbook, but walking into the door, you've got your mum hat on, you've got your spouse hat on, or you've got your single hat on. You're like, okay, I'm leaving what I need to at the door. So there was that more so that compartmentalization where we just haven't found that. And individuals are finding themselves like sharing a dining room table, or, their bedroom is also becoming their office, and that morphed environment doesn't allow for that sanctuary and doesn't allow for that downtime. And so also is that it's creating a stress response that's constantly been on, that if we've got a stressful working environment, which we have because we've had to flip it so quickly.
Yeah.
So we always feel quite heightened. How do we relax from that? Or is relaxing and self-care being put at the forefront of our mind? Well, not more often than not. Our hours have been working longer. Our boundaries have been poor. And so therefore it's now starting to pay a price. And we're seeing that not only through a mental shift, but also through a physical component, which is, I'm probably sure that's what you're seeing on the other end as well.
Yeah, that's really interesting. And I think, so really anxiety and burnout are the real, I suppose, the key features there. And you're sort of saying that there's a real lack of separation or integration of work and life with those examples that you gave. Did you read in the news recently, there was the talk of the fake commute? Have you heard of that term?
Walking, getting dressed, and walking around the block, and with your suitcase. Yeah, it is. It's really clever. Like it's something that, because what we've lacked in this time is structure as well. But it's certainly clever. It's also desperate times are calling for desperate measures, isn't it? Because it just seems so uncanny that you'd even consider this. But for some individuals, that really works. If that's something that, and there's a lot to say about even walking meetings. Like, if that's a time where in the morning you had your cup of coffee and you kind of segregated your day, or knowing, like structured your day, use that, go around the block for 20 minutes with your coffee, and if that's your thinking time to set yourself out, go for it. But
and I think
window.
Creating some routines is really, really critical. And I think what I've done and what we've been doing in our management team is every Tuesday we have a meeting that's normally on Zoom or Google Meet, but we've turned it into a walking meeting, and basically everybody gets out for that 30 minutes and we only talk for 15, and then we just encourage everybody to go and get that morning walk in. And most of the guys have reported that that's been helpful for creating at least one little routine in their day. And I think kind of stacking that up with some movement and then some environmental, change up, walking out to the river or something has been really nice for a lot of us. With those, and with those
processes. Sorry.
No, you go.
That's a big. There's a Zoom problem right now over talking over each other.
You got the lag there, yeah.
I said it's also like the sensory, we underestimate the power of our sensory processing, like, so having what we're seeing, what we're hearing, what we're smelling, what we're touching, what we're tasting, that ignites such creativity. And something else that we've seen so often, I suppose it's really connected with burnout, is our decision-making fatigue. That's starting to play on us as well, because we're not getting that creativity. So you'll see all these amazing, what were problems, solutions starting to come to the forefront now, because you're jazzing up what people are seeing in the morning. Good on you.
Yeah, that's right. And from a neuroscience perspective there, the prefrontal cortex is important. I'm not a psychologist, by the way. I'm just sort of thinking back to my physio days when I learned about the brain. So the prefrontal cortex is responsible for prioritizing, making decisions, expressing your personality. What else have I missed there? And I suppose what I'm getting at is with this whole pandemic, is it really the prefrontal cortex that's getting overloaded? Is that what's happening?
Or getting underused. So what end up happening is that if you look at the brain structure, that we've been under such extreme amount of stress, and and that's come from the environment that we've had to morph ourselves into, but also just that constant barrage of the unregulated media, and then how people are reacting to that, and that fear factor. And of course, like, I'm not taking any of that away from anyone, because that's probably got us to a position now of safety. Without that, people would have taken probably a lot more risk, so that they've really, second guessed everything that they've done. But because of second guessing everything, and because of having, I suppose, those catastrophizing thought patterns all the time, that's created us into that. It's held us in a stress response, and our whole body in a stress response. So that means that as part of our brain, as the limbic system has constantly been on, and so then when we have the limbic system on, it's putting us in a heightened state of, we're in a threatened environment. So our adrenal glands have constantly been on and pumping around adrenaline and cortisol. What ends up happening is that when our limbic system is constantly activated, our prefrontal cortex is not activated. It's a bit of a seesaw effect. So the prefrontal, so for the prefrontal cortex to start firing, the limbic system has to be deactivated. But if you're finding yourself as an individual constantly in that stress response, it's going to be far harder to use that rational thinking to come in, to use the decision-making process, to use the organisation and the concentration. And that's where we're seeing the fatigue in individuals, not only from a physiological effect because of the adrenaline and the cortisol constantly running around your body that does need to be switched off. It should be only in short, sharp bursts to get us out of a dangerous situation. But also because it's not allowing those messages to say, hey, it's okay. I've got my situation under control, and then to allow that rational thinking to come in. So that's where we're finding that conflict now. And as humans, the way we've been put in this stress response for so long is just not biologically viable for us.
Yeah. So that's really explaining that fight or flight response there, which is a great explanation for the listeners. And one other thing that I've seen in the media is the reference of surge capacity. So it's basically the idea that your brain or your body has a certain sort of backup battery, if you like, for these types of situations, but it's an ability to surge in a fight or flight situation, but it's not always there. It doesn't last this long, which is now 6 months. It's pretty crazy, but I really like that. Is that surge capacity something that you've heard of, or?
Yeah, absolutely. And I think that we used all that up in the first lockdown. And if you're like me, where you were also then feel the parental burnout as well, and juggling the primary school homeschooling hat. Hats off to teachers, by the way, and really feeling that juggle and dealing with, also your mental health of your child as well, and for them to actually understand that they can't do these things, and then them asking why. So you just had this huge impact that individuals, or we all saw that when we got this time and we've got 6 weeks and we're just going to go this lockdown, we're going to nail it, and we're going to really hit it. Everyone threw everything in, and you could see the way everyone's, you had the home videos and, you know, the exercise and change a whole garage into a full-blown gym and create the ultimate workstation and, you know, cook, you know, every bakery things under the sun. And we put all that effort in, but we also were really told, this is temporary, you know, lap it up. It's only going to be for a short amount of time. Think positive, right? So what ended up happening in that time, and it's always good in hindsight, isn't it? That no one really, everyone was dismissing how they were feeling. Everyone was like, keep going, keep going, keep going. So it kept us in that adrenaline, it kept us in that surge. And that's where we really used up all our batteries. So it caused, when especially the Victorian system got, and I suppose the rest of the states were certainly on edge because they saw what was happening in Victoria. When we said we've got to go back into this and it's going to be a harder lockdown, people just crumbled because they're like, I don't know how I'm going to do this. I've used up all my energy. I've used up all my adrenaline in that time. How am I going to do that? So even in our webinars and our own podcast, Sasha and I really had to change our tone and really go, okay, let's flip this right back now. And firstly, we need to acknowledge and validate and normalize how we're all feeling, rather than dismissing it like we might have done in the first lockdown.
Yeah, that's a really great explanation of surge capacity. How I've been explaining it to some colleagues and patients is like a 400 meter at that first lockdown. It was like a 400 meter race where you go, you know, it's a 50-second thing and you go really hard. And at the end, legs are like jelly, and that's kind of everybody got there. And then we were told, all right, now you're going to do another 400, and there's nothing left. There was nothing really left in the tank to use.
Or like probably more like Victoria, like you might do a 400, but it might be 600. It could be an 800. And then just as we got to the end, someone jumped out of the bush and went, "Hey, keep running!" And we're like, "Oh!" So we're seeing that, and that's really had a huge impact. And there's going to be some data out there, I think, for the next 12 months, Tom, that it's not going to look pretty. Unfortunately.
Yeah, I agree. And kind of with those, I suppose, anxiety and burnout, is there any, like, if there was one tip that you could give our listeners, you know, to help managing, I suppose, their mental health in general, just for the rest of the year, is there a hot tip that you could give to really sort of summarize, you know, burnout, anxiety?
Put yourself first. And I think that's something that's so important. And know your triggers. And one thing that we're not very good at is starting to tap into our own level of self-awareness. And you know, if we can start to connect, you know, how our body is reacting in certain situations, and then what our mind's doing, and then how we're behaving, we can start to connect that, I suppose, that thought, the physiology and the behavior. That's when we can start to create some interception within those times. And so it is about taking stock. Even if you feel like you don't even know where to start, keep a diary, start a diary up and express how you're feeling in the day and start to create those connections. You know, I started to feel really angry in the morning. Well, because what was happening? This was happening. Okay, I started feeling really excited. What was happening in your life? Well, this was happening. I started feeling really angry. And so you're starting to build up your emotional vocabulary. And I feel this is the first important step about, I suppose, really on the road to recovery, is that we need to validate how we're feeling, Tom. That's also going to create a level of normalization, because if that can open up a channel of communication with people, rather than say the beautiful word of "I'm fine, I'm just dealing with it," you know, fine has got probably 30,000 emotions behind it. But if we can actually say, you know what, today I'm actually feeling really stressed, and having that channel, or speaking to a colleague and having that buddy system, you know, creating that level of communication with someone to say, look, I just want to offload how I'm feeling, but you need to label how you're feeling first. It's the first step to say, hey, you know, for your buddy to turn around, or, you know, colleagues say, hey, you know what, I've felt that too, and this is what I've been doing. So that opens up that communication channel, which is really strong for a lot of individuals. And again, Sasha and I have found that once we can open that and we can get people to start to make those connections, then we can start to create the self-care techniques around that. Now, whether that is really looking at it from a physical component, you know, what actually relaxes you. Let's get back to getting you into more of a routine, you know, writing even down your days of where you're going to take that break and what you're going to do within that break. So whether that is that's going out for a walk, whether that is just lying outside with your shoes off on your grass looking at the clouds, you know, or more, I suppose, that typical mindfulness, whether that is, going to have, like, I suppose a cup of relaxing tea, increase your water intake because you may not be, or decrease your coffee intake because you notice the agitation comes after you've had your 5th coffee in the morning. Let's do something else there. To then looking at even reframing our thoughts to say, look, I'm constantly feeling so negative and I've got some really absolute thoughts here. What can I do to challenge that? How do I remind myself this is only temporary? How can I remind myself that it's okay to feel like this? But is it going, am I able, what else can I do to cope in this situation? It comes back to what we were talking about at the start, Tom, is that we're not giving ourselves the relief because our environment is not changing to create new thought patterns. For instance, if we had something that was stressful at work, when we go for that walk and we're going to the train station, that's not as impactful on our brains as if we were just sitting in it. And we're finding that we're sitting in those thoughts a lot more. So it's how we can actually pull ourselves out of it and within the environments that we can go and get to, that can just reduce or control that thinking that little bit more.
That's great. That's an amazing summary. So self-awareness is really step one. So doing some sort of diary where you're acknowledging and writing down what you're really feeling, and then trying to find a pattern of some sort and really linking your emotions to what your observations are. And then step two is thinking about interventions or things that may help you. So whether that's, as you say, mindfulness, drinking more water, going for a walk, having a cup of tea, that kind of, does that summarize that?
Yeah, absolutely. Anything that you find is really good self-care, anything that's going to provide even that level of, that structure as well in the day. Like, people have lost that control because they may have lost that structure and that boundary. And, like, just being, how can you differentiate your days, your work time to your home time, and then what can you do that's actually a lot more nurturing during your home time? I mean, we all had a bit of a giggle about how much more booze was drunk, and how we should have bought shares in Dan Murphy's in the first lockdown. I think in the second one, everyone's like, wow, I don't know if I'm going to be able to do that again.
They don't want to drink anymore. Yeah.
No, and we saw even a big uptick in substance use. It was like a 20% uptake in substance use and people not being able to cope. We actually saw that come out of WA of all things, where people just, because I think they came out of that lockdown and that was it for them. But they've come out a little bit, they still came out damaged, so it's a lot of times say, well, you know what, that actually doesn't put me in a really good mindset when I drink, so I'm going to do something different than drinking. What can I do instead? And that might be a magnesium bath. That might be utilizing more relaxing music rather than hardcore music that actually is making me more agitated. Everyone's that little bit different, but the aim of the game is to really get that stress response down. That's where we really want to get to.
Fantastic. Yeah, great summary there. And I suppose as we look ahead into 2021, I know we're busy chatting with a lot of organisations about mapping out 2021. What that will look like is a hybrid workplace, which really means people are at work and people are at home. In relation to mental health, what do you think you're going to see in your field in 2021? Is it really a recovery mentally from this year, or what are you expecting?
Quite a lot, actually. I think it's that feeling of unpredictability. So you're going to have a lot of anxiety there, and that fear factor is going to be there for a while, even with individuals. So that there's, it's about having, I suppose, that hybrid workplace where leaders have got to determine who's going to work best in what situations and when, because we want to get that I suppose that feeling of people being comfortable in their workplace and in certain environments, but at the same time, you've got to protect those KPIs. You've got to protect that productivity. So it is going to be a bit of a fine balance. I gather it would be a little bit of trial and error. So there might be some frustrations that lie around that. But we're actually working in that area also of altruism. Like, what's the helping behaviour going to look like towards other colleagues and also towards the general public? What's and are people going to be putting up their hands? When the trauma is there. This time, this has been a really traumatic event for a lot of people. Relationships have either been built up in this time or they've really broken down. They're looking again at parental burnout. Is just beyond parental burnout. It's also the fact that that even the child-parent relationships have been put under so much strain in this time as well. So we're kind of walking back in, I think, a little bit battered, and it's being really kind, and it's, I think, creating a mental healthy workplace that values that we're going to put you first, and what do you need, because if we can look after our employees and make sure that they are nurtured and that we've got a really strong avenue of communication, that's going to be able to bring people back in, and so they can have the optimal performance and productivity. But it would probably be about starting now, and building up that I suppose that expectation, and creating that, I suppose, even that nurturing expectation to move into 2021. So people are going to be, I suppose, the best they can be, moving into an environment that is still going to be whatever COVID normal. I mean, what is the COVID normal? We still don't know. So there's always going to be that underlying unpredictability, but it's acknowledging it.
Yeah, a huge role for leaders as well in this. They're probably one of the cohorts that is probably the most burnt out through this whole process, and having them having the ability to have these, I suppose, mental health conversations appropriately with employees is going to be a big challenge as well. Yeah.
Huge, and they've got to really start tapping into their own emotional intelligence here, utilizing a lot of empathy, a lot of active listening, and creating avenues, really creating those little bubbles of communication that, a lot of companies have said, okay, before we even start talking about the project, we're going to go around the whole Zoom virtual chat, how's everyone feeling, or an adjective that is describing how they're feeling today. And just doing that is acknowledging the emotion, but also increasing that emotional vocab and creating a safe place to express, I'm not actually feeling great today. And hopefully someone else can come in and then throw in some self-care techniques. So that's going to establish, I suppose, that real support bubble, and that trust. Yeah. To move in, and for employers to even put their hand to say, look, I'm not struggling in coming back to work for 3 days, and what can I do about it? So it's going to allow leaders, I suppose, a little bit more, take away the guessing game, because that's going to be quite frustrating to certain leaders too.
Yeah, fantastic. And that's really great, Natalie. So I think we've covered really well what you do. What are some of the key trends, I suppose, in mental health, especially during this crazy time that is COVID-19, and obviously some nice predictions for next year. My last question is for the listeners is, how can they best connect with you and Connect Psych Services?
Absolutely. Look, jump onto the website. We've got our phone number here. We certainly don't bite, as you can see. I'm as human as they get, Tom. and it'd be great just to connect in now and see what we can do. About supporting your staff. Just with that flexible and autonomous and convenient support for. To be able to move forward, and we've got an array of awesome practitioners and staff that work there and that understand the workplace, and the workplace is not just workplace issues, and it's not about that. It's about what's going on also in your personal life and how that is also brought into work. So we really want to look at the person as a whole. And being able to provide really proactive strategies to get them back on their feet as quickly as possible before mental ill health starts to occur.
Beautiful. Thanks for that summary, Natalie. Beautiful. I'll leave you there and take it easy.